accurate is echo compared to actually having a heart catheterization done?
So I think I can interpret this question in two ways. One is, are echoes accurate? And if so, are they comparable to the findings that if you did a catheterization? What I will say is that we are getting much better in terms of the technology of echocardiograms. So what we might have been able to see, a decade ago has improved substantially, but there is always the potential for error in an echo. For instance, when we think about the body habitus of our patients, for instance, women have breasts, and so looking through denser tissue, or sometimes patients have other underlying medical conditions. So trying to get good views of the heart in different patients sometimes can be difficult. And so that may skew or change the information that we're able to gather. The technician actually and the cardiologist reading the echo do tend to put that on the report that we would see, which is that it was difficult to get, the views that they wanted. And the heart catheterization is really a direct measure. So sometimes from my standpoint, I feel as though it's very repeatable, and that if I were to do that right heart catheterization over and over again in my patient, that I'd be able to gain the same information each time, where sometimes I'm not as fortunate with echocardiograms. Plus, echocardiograms are in the hands of a technician, that the data then comes to a cardiologist to interpret, where in the catheterization lab, it is a physician or a provider performing the procedure, and so their expertise tends to be one of more education and time in that specialty. But if we're asking how closely the findings on an echo will mimic the findings on a catheterization, for instance, the pressures that we estimate through an echo or that we directly measure in a catheterization, there have been quite a number of studies that have actually looked at this, where a patient had their echocardiogram and afterward went directly to get their catheterization with a very minimal amount of time in between. And what they did show was that, probably 85% of the time, the measurements were very accurate, but we still had times that they weren't. And so getting the right heart catheterization still remains the standard of diagnosis and care when we're trying to tell our patients what we are definitively seeing.